Since 1990, we have spent millions of euros and tens of thousands of research hours to find scientific answers to life's most important and challenging questions. What makes us happy? What makes us healthy? How can we heal from physical and mental disease? How can we heal emotionally and sexually so we can be happy in our relationships? How can we develop our talents and be of value to the world? We have interviewed more than 15,000 people and asked more than 4,000 different questions. After 20 years of intensive research, we are beginning to find the answers we have been looking for so long. We have already presented these answers in 250 research papers and about 30 books. Now we bring it all to you. Formal errors in alternative and holistic medicine. When you are treating a patient, you must understand the fundamental principles of healing. If you are not understanding these principles, then you cannot work according to them. And we call not working according to the principles of healing for errors. They are not, in a way, real errors, because you're not harming your patient, but you're preventing a therapeutic benefit, a therapeutic outcome. So you're wasting your patient's time and money, and you're also wasting the patient's opportunity to get better. So it is, of course, serious, but it's not really that you are harming them if you're not following these rules. The first and most important principle of healing is that you need to work with Antonovsky called self-genesis, like the whole being needs to heal. We call it existential healing. The concept of self-genesis was developed because Antonovsky studied victims of concentration camps after World War II. He was a Jew and he studied Russian women who had been in concentration camp. They had suffered a lot, lost a lot of family members. They had been raped and abused and really suffered a lot. And what he noticed was that a third of these people were actually quite well. You could not really say that they had been in a concentration camp. 2/3 of them were kind of destroyed, but a third of them were really well. They had just put this behind them, and they had just healed and continued their life as happy beings. And he was very, very surprised about over this, because obviously we can heal from the most horrible things, the worst humiliations, the worst sexual abuse. We can heal from even seeing our whole family die in a gas chamber. So he asked this question: why did they heal? And he found out that we have an ability of spontaneous healing, which we are normally not using. And he saw that the moment we are believing in this ability to heal, and we are supporting it, then the healing will happen. So the first error in therapy is not to understand that you are healing from inner resources, and the therapist's job is just like a gardener to facilitate the growth, to nurture the process of healing. This is a fundamental error, because if you're not understanding this, most likely you will waste your patient's time and money. The next principle of healing was discovered by the old Greeks. They also knew, of course, the principle of self-genesis, but it's called the principle of similarity. The similarity principle says that if you have been wounded, the only way you can heal is going back to the wound. You need to go into the wound, you need to confront the suffering, you need to open the wound again to cleanse it, so to speak. So if you have been raped, you need to go back into the rape situation, you need to visualize it, feel all the horrible feelings again, you need to really confront what happened and understand what happened, how you reacted, how you were wounded, etc. If you're not if you're not understanding that you need to take the patients back into the painful situations, into the gestalts, as Per said, then the patients are not healing. And very often as therapists, we don't want to push our patients into suffering and pain. We don't like to see them cry, and we don't like to feel that we are the reason for them crying. So we try to be sweet to them and nice to them. And very often this leads to the second formal error, and this is that we are not addressing the emotional issues that are the true cause of the problems, because we do not understand the principle of similarity. The third formal error is not to understand that healing happens with a lot of resources. In the old Greek medicine, you needed to be close to a patient to help the patient to heal. Only if you really were intimate and close, if you have a close personal relationship, if you were like a loving parent, and there was a kind of surrender of the patient into receiving the love, only in this situation could the patient heal. So if you're having a patient or a client and you are having a distance, if you're not having a close personal intimate relationship, a warm relationship, a loving relationship, then you are violating the third principle. It's a formal error to keep a distance, you can say, in alternative and holistic medicine, because then you're not supporting the patient enough to heal. No. The fourth principle, which also were very important for the old Greek doctors, is the principle of using as little force as possible. It's called primum non nocere, that first do no harm. And this was why the old Greek doctor says you can never use a plant or mineral or any drug to the mouth of a patient, because there are harmful adverse effects and side effects with all drugs and substances. So you cannot use these in the treatment, for instance. And of course, whenever you are using any level of force, drugs, surgery, any kind of force, you are making a new trauma. You're giving your patient a new trauma. So, of course, you need to use as little force as possible. And if you are a very good doctor, a very good therapist, you do not need any force at all. Just be present, and in this loving, supporting presence that you are offering to the patient will heal. The fifth formal error we have identified is a little tricky. It is a violation of what we call Hering's law of cure. Hering is the doctor who took homeopathy to America, and he said that a patient will always heal in the opposite direction of the way he or she got ill. And this means that you need to reverse the pathogenic process to have a salutigenic process. In practice, it means that you need to start with the now, and then you go to the immediate past, and then you go back in time, all the way back into the early childhood, even the birth and the fetal life. If you're not understanding that you need to walk back in time and undo the personal history and all the negative learning that the patient had, that actually created the patient's whole personality. If you don't understand it, you need to undo the negative learning, and in a way get rid of the personality, all the conditioning, all the negative learning. Then you have not understood what therapy is about, and then you cannot really help your patient. So these are the 5 formal errors you can do in alternative holistic medicine, the 5 ways you can be a hindrance to the patient's spontaneous healing in your presence.